Assalamu alaikum, everyone. Welcome to Saba's community Q&A. This Q&A is something that community members have been asking for, so they're able to get their questions answered about all the things that are happening regarding this coronavirus. Alhamdulillah, I'm really proud to have with me a great panel of experts. We have two doctors with us, Dr. Ijaz Naqvi and Dr. Farnaz Wahidnia. Unfortunately, Dr. Asad Hassoun isn't able to make it with us tonight. He's currently in the middle of doing a liver transplant surgery. Alhamdulillah, we have amazing community members who are out there doing great things. Inshallah, we'll be able to connect with him again in a future program. So I'll allow our speakers and panelists to sort of introduce themselves. So we'll have a bit of an opening statement from each of them, sort of talking about a topic that they think is important, and then we'll go to question and answers. The way we're doing the question answers here is that I'll be putting up a slide with the phone number for you to reach out to. Unfortunately, we're not able to do the kind of phone number at the bottom of the screen right now, but what we will have is let's see here if I can get it to display. Yeah, so here's the phone number. If you want to text in, you can start texting in right now with your questions. Hopefully they'll get answered by the discussion that's going to be happening prior to that point, but if not, definitely we'll try to get to your questions. Obviously we have a limited amount of time, but whatever we can get to, definitely we would like to. And inshallah, if there is really additional interest, then we can try to hold another session again. So with that, I'd like to turn it over to Dr. Ijaz Naqvi and switch over to him.
Okay, well, thank you, Asad, and assalamu alaikum, everyone. Once again, thank you, Asad and Saba, and then the BOT and Maulana Nabi Reza Abdi Sahab for hosting this very important webinar. And just to introduce myself very briefly, I am a physician with a specialty in pain management. I've been practicing medicine for over 30 years. I'm also director of graduate medical education and oversee several residency programs within Kaiser Permanente in the Diablo, Walnut Creek, and Martinez area. So with that little background introduction, what I like to do is just spend maybe about 10 minutes going over the signs and symptoms of coronavirus, what it is, so you're more aware. So the main idea behind this whole program was to raise awareness. As they say, knowledge is power. And so this is an attempt to do just that. And so the few topics that we picked up were going over the symptoms, signs, how do you treat it, and also what resources are available if you want to get further information. I'll actually first start with some of the numbers, and the numbers are very sobering. And I'll go at the end over the resources that are available to all of us. And one of the best one that I found is the Johns Hopkins University Center's Resource Center, and it gives you a live update. So some of the numbers are astounding. So the worldwide, we have, as of now, just a few minutes ago, we have about 722,000 cases worldwide. And then of those, just about 34,000 have died, 34,000. Just to give you an idea how rapidly it's progressing, I was going over the numbers to prepare for today's talk this morning from the same source. This morning, when I actually made up this short presentation, there were 704,000 cases worldwide, 704,000. When I just checked just before starting this webinar, that number had jumped to 722,000 or so. In other words, just today, 18,000 new cases were discovered. And then of the deaths, this morning, there were about 32,000. And few minutes ago, they were up to about 34,000. So 2,000 more people, unfortunately, passed away. In the United States, there are 142,000 cases reported. This morning, they were at about 132,000, which means we added 10,000 cases, new cases in the United States. Again, just to show how rapidly this is progressing. In the United States, they were reported about 2,400 deaths. In California, I'll go over the numbers, and this is from the California Public Health Department, these statistics. So in California, there are about 4,600 cases and 101 deaths. Within California, in terms of how this is distributed over age, because a lot of people have asked, like, hey, if we are young, does it affect the young? Are we should we be concerned only if we are older and say 65 age group? And the answer is actually all of the above. We should all be very concerned. In California, for example, about 2,400 cases were between the ages of 18 and 49. In other words, more than 50% of the cases actually have occurred in people who are less than 50 years old. In countywide, Santa Clara County probably has the most cases. This is where Sabah Center is. And there are about 600 cases so far and 25 deaths reported. Italy now is the #1 in cases, but it's #1 in deaths. Iran, for example, as of this morning, had 38,000 cases and about 2,600 plus deaths. In Pakistan, there were about 1,500 cases and 14 deaths. And the list goes on and on. The top 5 or 6 countries include now all European countries: USA, Spain, Germany, Italy, have already mentioned. So there is no country that is immune. This virus has been reported from over 170 countries. So that's just the extent of this pandemic, and it's very accurately being labeled as a pandemic. It affects the entire world. So let's talk about the signs and symptoms of this disease. To start off, the coronavirus does not have any symptoms that are very peculiar or specific to coronavirus. In other words, it's not like you have a certain symptom and you say, oh, that is coronavirus. It's not that easy. So coronavirus affects the upper respiratory system as well as the lungs. And it's an infection like the flu. So you have similar typical flu type symptoms. And those symptoms, as you may all be very familiar with, are a fever and body ache, just not feeling good, and cough. And in some cases, shortness of breath. And there are some other signs of more severe disease. For example, turning blue and also having mental status changes, meaning when you're talking, it may be not making sense. You're feeling cloudy or foggy, and then thinking is affected. So those are all symptoms of more advanced disease. And hopefully we don't want this to go to that stage. The symptoms actually can vary from very mild to very severe. And as has been reported worldwide, 80% of the cases are actually very mild. So just because you have coronavirus doesn't mean it's serious. In fact, a majority of the cases are what we term as a mild disease. And some of them are actually even asymptomatic. People have been tested positive when they had no symptom, which again is not really surprising. There's so many other viral illnesses where people remain asymptomatic, and you may have already heard, like you were tested, and your blood was tested for chickenpox or measles, and you turned positive. And you say, hey, I never had chickenpox or measles. But what happened was your disease was either so minor that you didn't notice it, or you were completely asymptomatic, meaning you did not have any symptoms, but you had the virus and the body developed antibodies, and that's what showed up in your blood test. So the same is true for coronavirus. You could have no symptoms whatsoever. The purpose, again, of all of these information sharing is so we don't go into one extreme or the other. We have seen people who are completely, for lack of a better word, ignorant. It's like, hey, this is nothing. This is just mild flu. It's just a hoax. It's overblown. It's an overhype, and so on and so forth. So that's one extreme. And there are others who are just really paralyzed with fear. Like they're going to get coronavirus and they're going to die, or they will very surely get coronavirus and have isolated themselves and just overcautious. So what we want to make sure is that we don't follow any of these two extremes. So the idea is to be careful without being fearful. So going back to the symptoms, when you have the symptoms or when you think you may have the symptoms, so what are the things that you should do? And again, the guidelines are from CDC, which is something I'm going to share at the end. And I will send these links to Brother Asad, who can then share with the rest of our community members. So going back to the symptoms, if you think you have COVID virus, then you, number one, need to stay at home as much as possible. Call your doctor or your advice nurse or even emergency room, depending on the symptoms. If you think you have mild symptoms, really there is not much you need to do except call your doctor, let them know what your symptoms are, and follow the advice of your doctor. One of the disclaimers I'll make here is this particular presentation is not meant to serve as a substitute for seeking medical advice. If you think you're sick, definitely call or contact your doctor or your healthcare provider or your nearby hospital that you're used to working with, and guide them through it. Every hospital has protocols put in, and they will guide you through the whole process. And pretty much all healthcare providers are following the CDC recommendations. So if you have mild symptoms, most likely they will advise you to stay home, take the usual precautions that Dr. Farnaz will actually go over what to do when you think you may be symptomatic. If you think you are having more severe symptoms, and this will include feeling really sick, very high fever, and shortness of breath, or pain or pressure in the chest, or feeling that like you're not thinking properly and your mental acuity is affected. If that's the case, you definitely have to not only call your doctor, but depending on the severity, you may have to actually call your emergency room or 911, once again, depending on the severity. Let them know what you may have. Now, of course, if you have a history of exposure to somebody who had COVID-19 positive testing, then this takes more of an urgent issue. Again, urgent doesn't mean that you must actually go to a nearby emergency room. But if you're planning to go to the emergency room, please let them know that these are the symptoms you're having, and especially if you have history of contact with COVID-19 positive patient. It's best to actually let them know ahead of time so they can be more prepared. So naturally, the next thing is, so how do you actually manage it? Once again, Dr. Farnaz will go over some of the things, but today what I'll talk about is maybe just medical treatment. As you very well know, there is no vaccine yet, and there is no specific therapy for COVID-19. The treatment is what we call supportive. So whatever the symptoms are, you treat the symptoms. If you have fever, you take Tylenol or Advil. If you have aches and pains, you could do the same. Stay warm. You can drink tea and things like that, but that's not proven necessarily. There are some medications that have been tried, and I'll touch on 3 or 4 different medications because they have been in the news. So as you may all have known, and if you heard President Trump go over this in one of the briefings that he had last week, he mentioned that this new drug called hydroxyquinoline or Plaquenil is a game changer, and then they went through a expedited FDA approval, and it is now FDA approved for COVID-19 treatment. Having said that, the medical truth is that this drug is still unproven in COVID-19. This drug has been around for a very long time. This drug called hydroxyquinoline or Plaquenil, it has been used for many rheumatological conditions such as rheumatoid arthritis and lupus, and people have been taking it for years, and it's relatively safe drug, but it's not benign. It's not 100% safe. So one must be very cautious. After that briefing, hydroxyquinoline became the drug of choice for everything, and it has been in such a high demand that within 2 days, pretty much all the pharmacies ran out of it. Again, that's a reflection of the hysteria that's going around. This is why I wanted to make sure that we have an informed conversation, so we don't act out of fear or ignorance. And so if you're not symptomatic, people were calling the pharmacies, getting the refills in, calling their doctors because they want to stock up on Plaquenil as if it was the toilet paper. And as you all know, the grocery stores shelves are empty and all the toilet papers are taken away. Again, a sign of hysteria and just unnecessary fear. So going back to the Plaquenil, it was FDA approved with an unprecedented approval process. It was approved in less than 48 hours after somebody, a physician in France, reported a small study. And the reason I said it's unprecedented is this is not how FDA process works. It takes months and even years to actually get a drug to be FDA approved. This drug went through a very, very small trial of just about 30 patients. And the Plaquenil was used in 20 patients, and it showed some improvement. Based on that, because of the nature of the disease, it became known worldwide. And the other strange thing was this drug was not even published in any peer-reviewed journal, which is, again, unheard of. You don't have this kind of notoriety on a small study. It was non-randomized, which means it did not meet the gold standard of how a new medication is studied in the field of medicine. But because of the unprecedented times we are living in, it went through a very expedited process. So that's hydroxyquinone or Plaquenil. There's a cousin of this medication without the hydroxy part. I'm not going to the chemical details or names of these two medications. Then there are other medications that have been used. There are some antiviral disease medications. One of them is called favipiravir, and the other one, which is used in China or has been studied in China, and the other one is remdesivir. Again, you don't need to remember the names. These are the other two antiviral medications that have been tried in some other viral illnesses, have been shown to be effective. And there are some small studies that came out of China where they used this in about 70 patients, and there was some evidence of its usefulness. Another medication that has been used, again, in this very small study is Zithromax or azithromycin. This is a medication that people have used for years for bronchitis. It's in the family of the erythromycin. So that is a small study in France that used the hydroxyquinone, also used azithromycin. So now there are several trials, drug trials, that are being conducted not only in the United States, but also in many other countries that are using these drugs as well as other drugs. And there are many other vaccines that are going through some trials, including a vaccine by Roche. And I'll let Dr. Farnaz talk about that since she works with them. So those are the treatment options. As you can see, there are not a lot of good options. And of course, the other supportive therapy would include, if God forbid someone has severe symptoms, they're having shortness of breath, and their lungs are filling up with water, which again is one of the complications of COVID-19 virus, then they can be intubated, be in the hospital, and put on a ventilator and receive proper treatment there. Now, in terms of where to get the resources, let me go over first where you should not turn to for information, and that's your cell phone with social media on. Facebook or WhatsApp or Twitter are not authentic sources of medical information, and more specifically about COVID-19. Let me repeat it. Facebook and WhatsApp and all of these forwarded messages that I'm sure you must be getting like 75 messages every day, like I've been. Honestly, I want to completely discourage using many of these because they are completely unauthentic. There is no medical basis for them. Now, if there's something very benign like gargle with lukewarm salt water, for example, or drink a lemon or tea, that's fine. I mean, it doesn't hurt you. But again, to think that this will take care of your COVID-19 virus is completely unproven. So what are some of the resources that you really do need to go over? And I'll try to make it simple. There are a number of resources, and people can get overwhelmed. But the three that I think are most important, the most authentic, and most up-to-date, number one, I'll say, is the CDC. The website is www.cdc.gov/COVID-19. There's tons of information there, and it's meant for lay public. It's not necessarily meant for medical professionals. There's obviously a different site or page for the medical or healthcare professionals, but it's a great resource for lay people. Again, the website is www.cdc.gov/COVID-19. The second source is Johns Hopkins Hospital Resource Center. And the website's address is, and I'll send the address to Brother Asad, is https://coronavirus.jsu.edu. This particular site has a lot of updated information. It has an interactive map of the world, including United States, Iran, Iraq, Pakistan, India, and all the other countries. It gives you an updated, almost to the minute, of the number of cases reported and number of deaths. The third and the last resource I'll mention is your local state public health department, the California Public Health Department. It has the most updated county information, California state information, and so on and so forth. So please do rely on these resources. And of course, if you have personal questions, always feel free to talk to your own doctor or your advice center. So I know I spoke for a little bit longer than I thought I would, but I'll stop here, and I'll have Dr. Farnaz maybe go over in her presentation, and maybe we'll have the question and answers after her presentation. Thank you.
Thank you very much, Dr. Ajaz. Really appreciate you going through all that. For sure, the links that you mentioned, I'm going to post them on the video description. And for those also who are interested, you know, we can send them to them directly. I've sort of been sharing the screen where we have the phone number posted for anyone who wants to ask questions. I can give you that number now. Again, it's 510-400-7336. That's 510-400-7336. I'll try to frequently cut in and out, or just, you know, display the phone number again as you know, we're going through and talking. Dr. Farnaz, Vahidnia is also here with us. You can please go ahead and text that number to ask her questions, but I'll turn it over to her now, and then we can go afterwards to a Q&A format.
Thank you, Brother Asad. Assalamu alaikum, everybody.
Welcome.
And thank you, Dr. Ajaz, for the very detailed presentation going over the history, statistics, and some treatments. I don't want to take too much time. I don't have a formal presentation ready, but I thought maybe just mention a few points before we go into the Q&A, and then I would like to spend more time on Q&A and answer questions that are really critical and our audience is interested in. What I wanted to add to presentation by Dr. Ajaz is a little bit of the history of the disease, where it comes from, and what is similar between this COVID-19 disease and what we saw from the previous coronaviruses in the past. So what we saw in the recent epidemic is at end of December of last year, there was in Wuhan of China, there was pneumonia of unknown origin that was announced. Within a month, about 31st of January, World Health Organization announced a global emergency of a novel coronavirus. And then later, they announced that virus to be called SARS-CoV-2 or COVID-19, which is similar to the coronaviruses that we have seen in the past, like SARS and MERS that I will mention in a minute. And then in February 11 of 2020, this year, World Health Organization called the disease that is caused by this novel virus COVID-19. So that's a little bit of history. But why do we call it SARS-CoV-19? So in 2002, coronaviruses, one of the coronaviruses that we are familiar with is SARS, that caused an epidemic in China and Southeast Asia. That's the first time that we had this disease of causing a large epidemic. Within 6 months, infected 8,000 people. 35% of them had severe respiratory disease with 774 deaths. So less than 10% of the patients who had that infection died from SARS-CoV. Another epidemic by this group of viruses, coronaviruses, which is called MERS-CoV, in 2012, it started in Saudi Arabia, and it had about 2,500 cases infected, and 34% of those patients died. So that virus had a smaller number of cases in that epidemic, but with a very high fatality rate, basically number of people who die over the number of people who get infected and are diagnosed with the virus. And the outbreak was limited to people who travel to Saudi Arabia on Arabian Peninsula. What is different between this new virus, novel coronavirus, and what we saw in the past? There are a few main differences that I think it's important to know why we care about this and why it's happening so rapidly, and why we have to be concerned, at the same time not to panic about it. First of all, it can infect much faster and quicker than the previous coronaviruses. Each patient who is infected can infect 2 to 3 people at least, and it could happen within 15 minutes that you are in close contact with a patient who is infected. And when we say a patient who is infected, it doesn't mean a patient who is actively showing signs and symptoms of the disease. It's not a patient, somebody could have the virus, shedding the virus in their droplets, and but they don't have any signs and symptoms. So that is where we are very much concerned, because people could walk seemingly very healthy in the community and infect other people. And then, so that is the first thing, rapid transmission and transmission rate, very high transmission rate of this virus. The second thing that is concerning is that when people get sick, as Dr. Ejaz mentioned earlier, majority of people have very mild disease, like a flu, and they can get over that with resting at home and with some symptomatic treatment. But people who are at higher risk, elderly, people in the community who are over age of 65, people with heart disease, with diabetes, with hypertension, and or obesity, people who are on cancer treatment, are at higher risk of getting the severe case of the disease. And when we see some countries and some numbers where a lot of deaths are reported versus the number of patients who are infected, and we might think this is having something like 7% to 10% of death rate, on average, there has been 1 to 2% of the patients who are infected, based on the statistics that we have from China and other countries, could die. But again, age of the community, comorbidities, and other background diseases that people have, and the testing strategy is affecting this number a lot. So you might see a wide range of numbers and might wonder why in some communities and countries there is a large number of deaths reported versus the number of people who are infected. And these are all affected by that composition of the community, the population, and the testing strategy. If they are testing people who are apparently healthy and only have symptoms, you might see a lot of people who test positive, but they get recover and they don't show severe cases. With that, I just want to touch on the testing strategy and the recommendation by CDC and World Health Organization. And here I should have had that disclaimer when I started. This, what I'm saying here is all my personal information, my experience from my background and training in medical school, and my what I read and heard and saw in Tehran 2 weeks ago when I came back from there. And it has nothing to do with my employer and where I'm working. But the recommendation that I'm saying is publicly available. It's CDC recommendation for testing. Not everybody should be and can be tested. That's the first and most important thing. To panic and rush to the hospital and emergency room just because we have you're coughing or we have fever is not a good thing, not only for us, not for community, and not for the health of our loved one. The number of tests are limited and are saved for the people who have the most need to get tested, diagnosed, and being treated. So there are the top priority that is recommended to get tested are patients who are hospitalized, who have severe cases and are in the hospital, and healthcare providers who have symptoms. So these are the people who at highest risk and should be tested definitely. The second group that are recommended to be tested are patients who are in the long-term care facilities with symptoms, first respondents who have symptoms, patients 65 years and older with symptoms, and patients who have underlying conditions like the heart disease, diabetes, and other conditions that I mentioned earlier with symptoms. What is recommended not to test people who have mild symptoms, they are not in priority, and individuals who don't have any symptoms. They are not recommended to get tested. So with this, I would like, how much time do we have, Brother Assad?
Can you hear me? I think we have time.
Okay, so yes. I will just maybe just go through
maybe
a little bit about,
because now the questions are starting to come in fast here.
Okay, I would like to stop here then and let answer questions as they come up instead of going through topics that might be redundant.
Okay, sounds good. So I'm going to go through some of the questions and see if we can get to some of them. Sorry, just displaying the questions here. Okay, so first question is, if someone has recovered from COVID-19, is there a chance they can get it again, or will they be immune in case another phase of this virus emerges later on? So this is a question to either one of you. It's a sort of an interesting question that has come up because this is a concern if we can reinfect ourselves.
So I mean, I'll be happy to answer that. So what we know, if you, I mean, we just talked about the similarity of this virus with other coronaviruses and similarity with flu or just common cold. So as you know, we might get common cold or we might get flu multiple times. And every year we might get flu, and that's why we get vaccinated for it every year. So this is the same case with many viral infections. There is no vaccine for this virus. So getting infected with the virus could be kind of like you would assume that you get some kind of natural immunity with developing antibodies. but we still don't know much about the natural course of the disease. We don't know when and how much the antibodies will go up and how much immunity it is going to give you. The common understanding is that you might be able to acquire the disease and get infected again with different versions. So it doesn't give you lifetime immunity until there is a vaccine that is under trial. And if the vaccine comes available in mass production, then you might need to get the vaccine every year.
Can I add something, Dr. Farnaz and Asad?
Please. Mm-hmm.
Yeah. So Dr. Anthony Fauci, who is leading expert with the presidential team, actually did address this very question a couple of nights ago, I believe. And so of these 140,000 cases, he basically is using this in statement, or made this statement based on data available right now. So of the 140,000 cases so far, there has not been a case yet of a reinfection, which does not mean that this person will not get infection again, say 6 months or a year from now. But as of now, there's no case of reinfection. And once they've recovered, at least they are quote unquote immune for the time being. But just like flu, if you had the vaccine, it only protects you from getting the flu that year. And even that, as you probably know, is partial protection. Dr. Fauci also mentioned that so far, all the cases that have been isolated, there is no case of virus mutating itself. In other words, this virus so far has not mutated into another type of virus or another strain of virus.
Got it. Okay. Thank you. So let's go to the next question here. Okay, this is a question I think a lot of people are sort of coming to grips with as we sort of have entered sort of a new way of living. I'm afraid of going outside or even for groceries. I'm concerned this level of fear may not be rational. How do I know if I am more fearful than I should be, and how should I address it? I mean, it's something sort of we're all bringing ourselves up to speed on sort of how to deal with this, and wondering, from either of you, if how we should sort of place the sort of fear that we may have about something that's like this that's happening.
Yeah, I think, may I go, Dr. Farnaz?
Mm-hmm.
Sure.
It's a valid question because we are constantly being bombarded. But like I said, if you were there maybe at the beginning of this webinar, I had mentioned we need to be careful without being fearful. And so take all the precautions, and we have to kind of gauge our own risk. So people who are otherwise young and healthy, they tend to do well, even if they get the COVID-19 infection. Now, people who are over the age of 65, who have chronic conditions like heart, lung disease, emphysema, chronic diabetes, and they may be immunocompromised, or they may be using steroids for medical conditions and they are immunocompromised, their risk is higher. So that group, I do think the elderly or people who are at high risk for not only acquiring but having more complications, it is very reasonable for them to be at home and not go outside. Even actually the social context and social distancing, even within their household, should also be limited in terms of visitors and family visiting them, et cetera, et cetera. And that's, again, also CDC recommendations. So it's not just my own recommendation. And I think it's a solid one. But if you're what we will consider average risk, going out to do groceries is perfectly fine. As long as you're using the same precautions, which Dr. Farnaz will go over, the hand washing, hand sanitizer, et cetera, which I think she was going to touch on a little later. So what I would suggest, again, the bottom line is do not be fearful, but do take the necessary precautions.
Okay. Dr. Farnaz, was there anything you wanted to add on that?
Yeah, maybe this is time to, I mean, that is a great question, and Dr. Ejaz answered the question, but maybe I can say a little bit about how you protect yourself and protect others. So there are two things to think about it at this point. We are taking caution to protect ourselves and our family, and to protect other people from getting sick. So first of all, to protect yourself, no matter if you're home or you go out, you need to be extra careful and do extra practice to clean your hands. Wash with soap and water if it's available. If you don't have access to soap and water, you can use hand sanitizers. And try to not touch your eyes, your mouth, and your nose when you're touching stuff at the grocery. When you go to grocery, try to minimize your time. Have a list, go as quickly as you can. When you see something, you pick something, don't touch stuff and put it back. When you touch something, just pick it up and bring it home. And try to avoid close contact and keep your distance with other people. Don't go to crowded areas. Keep your 6 feet or 1.5 meter distance from other people as much as possible. So one person, a healthy young person within each family, can go out to grocery, try to do grocery for 2 weeks so you don't have to go there often, and bring home the grocery and all the essentials to your family and people who cannot go out. Usually it's a good idea to think about other neighbors or other people in the community or family members who are older, and it's better for them to stay home, and somebody else would be designated person to go out and do the shopping, grocery shopping for them. So that's one thing, and it's doable, and it's not, you shouldn't put extra work on yourself or extra fear on yourself. The most important thing is to think rational and try to keep the hygiene and follow the hand washing instruction. And then if you get sick, you just stay home. If you are having fever, cough or sneeze, or any respiratory symptoms that are mild, stay home and try to avoid contact with other people. Cover your cough as you're supposed to do, like this, not with your mouth. If you use tissue, throw out the tissue and don't use it again. And use a face mask only if you're sick, a mask only if you're sick. And for cleaning and disinfecting, using any EPA labeled household product for cleaning and disinfecting would work. If you would like to make your own, you can combine bleach, the household bleach, at 5 tablespoons, adding to a gallon of water. So you can dilute it and use it. And that would do the same, and that would be useful for disinfecting and cleaning the surfaces as well.
Okay, great, thank you. Let's get to the next question here. Again, if you do have questions, please do go ahead and text us at our phone number 510-400-7336. That's 510-400-7336. Going to the next question here. Let's see. What will the vaccine do if it takes 18 months to make? Will COVID-19 stay for 18 months? So this is something that I've sort of read about as evolving understanding of whether or not the virus itself is mutating, and whether or not the vaccine that we're sort of working on now is going to be effective, to treat whatever version of virus is out there 12 to 18 months from now. So I think that's sort of what the questioner is sort of alluding to. Dr. Farnaz, would you like to?
So maybe, yeah, just a quick answer to that is that the virus is not going away. It's going to stay with the human being and for a long time. What we say it goes away is that the epidemic and the rate of transmission, what we are trying to do right now is trying to, by doing physical distancing and trying to reduce the rate of transmission, slowing down the transmission, and just buying time for our scientists and to develop and produce a vaccine in large enough number that can be used. So, but that doesn't mean that the virus is going away. It will stay within the communities at a very low rate, which is not called an epidemic anymore. And we still don't know about the pattern, seasonality of the virus and the disease. It could go down and slow down as the weather changes and become warmer, but we don't know yet, because this is the first year that we have seen this disease. But if that is the case, as it is the case with flu and with other coronaviruses, then we will see it going down at a very low rate, stabilize, and then coming back again next year, next winter. So that's when we need the vaccine. And by then, the vaccine that they're working on right now should be used for the next season.
If I may add one thing here, and Dr. Farnaz, you're the expert and this is your field, but just we have the same scenario for flu virus, right? So the flu vaccine that you received this year was actually based off of the virology and epidemic from last year. And this is why the vaccine this year was only about 50% to 60% effective. I would anticipate that something similar will happen to COVID-19 vaccine. When it is made, it is still going to be based off of the previous year's COVID-19 virus. And
that's correct. Yeah, that's correct. And we still don't know how much. As you said, Dr. Fauci has said that we haven't seen any mutation in this season, but we don't know when and how much mutation we will see for the next season. But the vaccine is made based on the current version and the strain that is going around.
Okay. And Dr. Farnaz, you have a sort of unique view into this based on sort of the experience that you had when you were in Iran. I don't know if you feel comfortable with it, whatever you're sort of able to share with sort of what you saw there and sort of how the public's sort of reaction to it sort of has affected how deadly the virus has turned out to be.
Yeah, I don't mind. I think it was a unique experience for me. I had to go back to Tehran to take care of my parents. Both my parents were sick. My father actually was hospitalized with severe respiratory distress, even though he didn't have any underlying condition or any of the conditions other than the old age that he has. But lucky enough, and thanks God, they're both recovering right now. It was a unique experience to see my colleagues and my friends who are working in the field and how much effort they're putting into this and how they are sacrificing. The case of Iran is completely different and unique case because of its isolation from the rest of the world due to sanctions and shortage of many supplies and the way that they are trying to just make it work. Right. So that's one thing, and just being helpful when you see the spirit of the healthcare workers there with seriously minimal supplies. They are trying to do their best, and everything is just grassroots. They're not waiting for the government to come up with a protocol or issue an order. They just do it as they're supposed to do. So that's completely different experience. But what I want to say, being there for 2 weeks and taking care of two sick patients, I would say that it's doable. I was where everybody in Tehran was kind of like stuck at home. We had to go out to the hospital to run some errands, take care of stuff, go to the pharmacy, go to the lab. So it's doable to be in that situation and come back with a negative test result and still, thank God, still I'm healthy. I traveled across the world. I'm still healthy, but I'm in self-quarantine myself since I came back last week. I'm staying in my room, and I haven't been in close contact with my family since I came back. So I will do that for 2 weeks to make sure that I'm not developing any symptoms, and I'm not one of those people who is carrying the virus without the symptoms. So I think this is the main message, and not to fear, and just take care of your everyday business as it is essential. Minimal you're going out and your interaction with other people, but if you have to, you have to, and you can still be safe and healthy, inshallah.
Sure, inshallah. Alhamdulillah, you came back safe, and your family is safe there. You know, it's great that you sort of touched on the steps that you're taking yourself to kind of quarantine yourself, to protect your family. You know, so sort of in a way, it sort of takes everybody a moment to kind of get themselves to the point of, you know, oh, well, you know, I don't feel sick. I don't have any cough, but so I must not have it. But to sort of, you know, take care to be careful that, you know, as you guys said, that, you know, someone could have it for, you know, 2 weeks, at least from what I've heard. You guys can confirm, but not even know it. And then 2 weeks later, you know, the symptoms sort of flare up. You know, sort of in that regard, you know, I had a question about whether or not it makes sense, you know, with the shelter-in-place order that at least we have in California and a lot of other states have, people are doing their best to sort of stay home, and inshallah, everyone is able to do that and is able to do that safely. But there's sort of this question of, well, you know, is it, if we're not going out to sort of large gatherings, if we're not going out to, you know, great America, are we at least able to sort of go between households? You know, as if I've got my mom or my sister or someone else that's in another home, you know, is it sort of fine to shuttle back and forth and visit others sort of at a time like this?
I would say no until we pass the peak of the epidemic. And from the data that I was just looking at this morning, we are not there yet. The peak of epidemic in each state is different depending on the number of cases and the measure, the distancing, social distancing measurements and orders that have been in place. Mm-hmm. In California, we are lucky that we still have some time. There's still, it's expected to come, the peak to come up in 2-3 weeks at least, but it could be longer. So we are not safe. And I want to emphasize on stay home and don't go out if it's not necessary, and try to avoid more group and crowdless more than 2 people. That's what people who were conscious in Tehran were doing. They didn't even visit their parents. And as you know, a week ago, 2 weeks ago, 10 days ago was the Persian New Year, Nowruz. And that's the one time that Iranians go out and visit their parents and grandparents and elderly in the family and everybody. They go to like 5-6 houses a day. And people were very conscious. And I'm really, I think it was, I'm really proud of how they were trying to celebrate the New Year in a different way this year. People didn't even go to see their parents. They just called them, FaceTime, WhatsApp, and just by digital communication. Tried not to infect them and not to infect other people. That's the only thing to do. And I think that we should continue doing that.
And as a reminder, and Dr. Fauci had also mentioned that in one of his briefings, is that you, even if you don't have the symptoms, the younger people, especially the millennials, they may think they are fine, they're healthy, but they actually may be the carrier. And this is why I think it's even more important, if you're in this 18 to 50 age group and you feel healthy, is to minimize that contact, because you may actually be a carrier, if you will, asymptomatic carrier, and still pass on to your elderly parents or other relatives who may then not do as well as you do.
Okay, Great, thank you. So let's move on to the next question here. There has been debate regarding prevention of COVID-19, whether a droplet or airborne precautions should be taken. Should we follow CDC guidelines or OSHA guidelines regarding prevention? Dr. Farnaz, you want to take it? So, I mean, how is the transmission actually sort of occurring between people?
So the transmission is through droplets, respiratory droplet of a patient who has the virus. The virus is using the lining of your upper respiratory system, your nose, and your throat, to reproduce, and that's where the virus exists. So when a person who has the virus is infected, is sneezing, coughing, or making is in close contact with you, the droplets could carry the infection, and it either sits on the face of another person who gets infected, or you would touch surfaces that has those droplets, and then with touching those surfaces and touching your face, unconsciously you will transmit the infection and the virus to yourself.
Okay. Dr. Jaz, do you want to add?
Yeah, just so remember, in more than 95% of the cases is still droplet. Now, what the questioner may be referring to is, in some cases, it may be what we call aerosolized, and then it becomes airborne. What that means is that the droplet infection is, like Dr. Farnaz said, coughing, sneezing, and it just, whatever comes out, it usually travels up to about 3 feet, typically. Now, the airborne travels a lot longer. So the airborne infections are typically like tuberculosis. COVID-19, generally speaking, is not an airborne disease or aerosolized, but it can be made aerosolized in certain conditions. So, for example, when somebody is getting a nebulizer treatment, either at home or in the hospital, or when somebody is being intubated in the process of mechanical ventilation, or being suctioned in the hospital, in that case, the infection can become aerosolized. In that case, there is a different and higher set of precautions that people around them need to take. But at home, by and large, it is just droplet infection.
Got it. Thank you. And just for, we have quite a few people that are watching, and for those who didn't get a chance to tune in at the beginning, maybe if both of you can also just sort of reintroduce yourself, your background, sort of what your medical specialty is, and that way everyone who is, been able to join, in the meantime, is able to come up to speed on your backgrounds. Dr. Farnaz, would you like to start, please?
Sure. So I'm a medical doctor by training from Tehran, and I did my master in public health and epidemiology, PhD in epidemiology at UC Berkeley in infectious disease. I worked with UCSF Research Center for a few years after my PhD, and right now I'm a principal senior scientist at Roche Diagnostic in California.
Great, thank you. Dr. Ejaz?
Yes, I'm a pain management physician. I'm board certified in internal medicine and pain medicine. I did my residency training over at USC Medical Center. I did my medical school in Pakistan, Sindh Medical College. And I'm also a director of graduate medical education with Kaiser Permanente in Walnut Creek area. I've been practicing medicine for over 32, 33 years. Great. And I'm also on SABA's COVID-19 task force.
Thank you very much. Yeah, so let's move on to the next question. As we start getting closer to the time we want to wrap up, maybe we can try to keep the answers short. So I know there's quite a few people who have questions. We want to try to just at least touch on them, if not go deeper. And we can, if there's interest, inshallah, we can have the the great doctors we have here back for another session, inshallah. So let me just share the next question here. I heard that Kalonji has the hydroxychloroquine. Sorry for the misspelling there. Which doctor? I think Dr. Ijaz, you had maybe mentioned the hydroxychloroquine. Which Dr. Ijaz had talked about. Is that true? Should we be eating it? This is a sort of a good question to touch on, because there's been sort of this I don't know, mythology in a way that's sort of been built around this hydroxychloroquine, that it's sort of this miracle drug, and it's a question because, you know, it's already sort of available as a to treat parasites in fish tanks, I believe. And there was actually a case recently where a couple unfortunately sort of had consumed it in a way to sort of prevent themselves from getting it, and unfortunately someone had passed away. So do you mind, Dr. Ijaz, to sort of address this?
So I have heard this again through my WhatsApp and social media pages, and I don't know how true it is. And first of all, hydroxychloroquine is a synthetic drug, and for a synthetic drug to be present in a natural product is somewhat going to, I need more data, and then I'll repeat what Dr. Fauci has been saying. I think our recommendations have to be data driven, and I don't have any data to back that up. So my conclusion will be there is no data to show, one, that Kalonji has hydroxychloroquine, and two, it is as the necessary amount to take care of it. Having said that, the other thing that you have to remember is, and if you were present at the early part of this webinar, there was a very small study that showed this drug to be effective, 30 patients. And of that 30 patients, only about 20 patients showed this effectiveness. So it's a very, very small non-randomized study to start off under medical conditions or research conditions. And number two, there was another study that was done a little bit higher number, 70 patients in China after that study came out. And so far, that study has not shown any effectiveness of hydroxychloroquine for COVID-19.
Got it. And just to translate for those who don't know, Kalonji is, I think in English, is known as black seeds, if I'm not mistaken. But let's get to the next question here. Just in there some time.
Just to clarify, there is no treatment proven so far for the disease COVID-19, and no prevention so far. Everything is experimental and is still in trial. So whatever that is spoken and is mentioned out in the news, or you see or you hear, is all experimental, and it's not approved by the FDA and by the medical community.
Okay, great, thank you. So just also in the interest of time, I'm just going to read the questions out. According to the CDC, the virus can stay in the air for some time. Should wearing a mask outside be a recommended practice for everyone, even if they aren't sick? Dr. Ijaz, would you like to start with this?
No, that's the shortest answer. Again, the CDC is recommending, Dr. Fauci is recommending, the face mask is only for those who have the disease. It has not shown to prevent acquiring the infection. So even if it was airborne, which again it is not, then it is not the recommendation.
Okay, Dr. Fernaz, did you want to add anything?
Just for the people who are sick or are taking care of the sick people.
Okay, great. Another question we've gotten is regarding pets. Should pets be kept inside during these times? Can we get it through our cat? Can we let our indoor-outdoor cat outside? I think it's an interesting question, because some people are sort of concerned about other ways of sort of being infected with the virus. Dr. Fernaz?
So the coronaviruses need an intermediate host to be transmitted to the humans with with MERS, we know it was camel. With SARS-CoV, we know it was rat. With COVID-19 or the novel coronavirus, we still don't know what was the intermediate host. So that's said, I haven't heard or read anything about pets to transmit or be the intermediate host for this virus. Dr. Ejaz, if you heard anything or know anything.
No, actually, if I may, if I could go back to the previous question about Kalonji, there are some sites, and I just quickly take another look at it. There are some sites for complementary and alternative medicine. And then the ingredients, there are a lot of phytosterols, but I didn't see any mention of hydroxychloroquine or chloroquine, which is a related compound. So all the compounds that are listed as ingredients of Kalonji or black seed or black cumin, there is no mention of this compound.
Okay. So I'll compress a few of these questions into one one group here. There's a few questions that are we got in regards to if someone themselves get it. So sort of if someone themselves get it, how should they quarantine themselves within their house to prevent others from potentially being infected? How should we sort of keep ourselves away? And I have a child and I'm worried what will happen to him if my husband and I got hospitalized. So I don't know, at least regarding the sort of social ramifications, but at least in regards to the medical ramifications, if you could touch on that. Maybe Dr. Ejaz, we'll start with you.
So the CDC page, the site that I recommend, it has very specific information about what to do if you are sick. So I would highly recommend to go back to that. I mean, you need to actually hear, as they say, from the horse's mouth. And is very clearly spelled out. It does talk about if your symptoms are mild, stay home, do nothing. I mean, you obviously have to talk to your doctor, let them know what symptoms you are experiencing. They will go through the protocol. In most cases, you will not be tested, but you do need to self-quarantine yourself for at least 14 days, which is the duration that has been recommended. And so in that time frame, you're doing the maximum precautions. That includes social distancing, 6 feet apart from other people, covering your mouth, just like Dr. Parnaz showed you how best to do it, and so on and so forth. And also avoiding using the towels, the utensils, and not sharing with anyone else. And right after that, wash them thoroughly with soap and water. And then if your symptoms are more than just mild, you definitely need to get in touch with your healthcare provider. And of course, if your symptoms are more severe, that include shortness of breath, or you're not feeling good with breathing and you're feeling pressure in the chest or have chest pain, absolutely call the doctor, as well as, depending on the severity again, call 911.
Thank you, Dr.
Again, this is not to scare you, but again, if you have doubt, always seek medical advice.
Right. Definitely. I think that point sort of underlines everything that we're talking about, and you mentioned at the beginning too. Definitely, do reach out and seek sort of your own doctor or medical advice. So we've gotten some questions that I've haven't really pulled up for us to go over. A few people sort of giving a list of their symptoms, but what we can give here sort of are a lot of the sort of general guidelines and sort of as deep as we can get. But if there's anyone who has sort of specific symptoms they really want to know, as Dr. Ejaz said, reach out to sort of someone that is your medical provider. And I believe there's a number of applications that have been put out there for the phone, and I know Apple has one, and I believe Google has made a site as well for testing, that you can sort of go through the symptoms that you have and find out whether or not it's important for you at that point to get tested, or sort of what steps you should be taking.
If in doubt, call Dr. Google, right? But no kidding. Yes. So there are definitely apps that can go through or take your the symptomatology. One of the symptoms that may be actually reassuring is a lot of people, especially in this allergy season, are sneezing and have a lot of runny nose and discharge from their sinuses, and they feel the sinus pressure. That, generally speaking, has not been reported as a common symptom of COVID-19. So typically the symptoms are more lower respiratory. That includes sore throat and chest congestion, breathing difficulty, et cetera, et cetera. But the sneezing, the runny nose, typical symptoms of allergy are usually not the reported symptoms of COVID-19.
Got it. Okay. And Dr. Farnaz, the question that I sort of had talked about, sort of quarantining yourself and sort of wanting to keep yourself safe from the family is sort of a personal question. It kind of hits personally for you. As you had mentioned, you are sort of keeping yourself away from the family, and wanted to know sort of just a few of the sort of steps that you're taking to limit the potential for that transmission to others.
So, I mean, this is for people who have been in contact with a patient who has been positive for the COVID-19, or the people who have mild symptoms like fever, cough, and respiratory symptoms.
Right.
Try to avoid contact and keep distance from your other family members, 6 feet apart at least. If you can, it's better to have a separate, use a separate bathroom, and not to share with the rest of the family. Separate your, eat separately, and don't share your utensils with the rest of the family, and sleep in a separate room. That's basically the main things.
Okay, great.
One thing, if I may quickly add, Asad, is so if you think you are sick, and so other thing that is done, especially at work as well, is cleaning up everything that you touch. That includes doorknobs and door handles and your keyboards and your cell phone, TV remote, et cetera, et cetera. Everything, when you touch it, when you're done, make sure that you clean it up with Lysol or similar wipes. Just make sure that they're disinfected.
Right. Okay. Just if we can get a quick answer on this in regards to any studies done about the latest flu vaccine that may have an effect on the coronavirus. There had been, sort of at the beginning discussion about, oh, can we, how similar are they? Can we just sort of use the flu vaccine for this? But thoughts on that, Dr. Farnaz?
It doesn't. The flu vaccine doesn't protect you from COVID-19.
Okay. Okay. And then another question was, can the virus live on packages and fresh produce? What care should we do to handle packaged food and fresh vegetables and fruits? Can we eat uncooked vegetables like fresh salad? Dr. Jaz, you start there.
Yes, the short answer is yes. CDC actually specifically addresses that. This disease is not transmitted by food. So just do the regular washing that you would normally do. Now, of course, if you're eating an apple that somebody just sneezed on, that's different. But generally speaking, it's not a disease that's transmitted by food.
Yeah, the only caution you have to take here is the packaging. When you bring packages from the store, because you don't know exactly who was around and how it was handled, it's good to uncover and unpack everything outside of the house. Either create a clean zone in the house by taping at the front door at the garage, just by putting all the packages and all the bags there, and unpack them and then transfer them to your home.
Great. Okay. Okay. Well, I think we've gone through majority of the questions, if not almost all of them that have been asked. But as others do come in, we'll definitely try to either answer them in some way, either in a supplementary email or maybe in the description of the video itself here on YouTube. If there is sort of interest and additional questions that come up, Dr. Jaz, Dr. Farnaz, and Dr. Asad as well, if we're able to steal away an hour or so of his time, we would love to have you guys back for this community Q&A. So really appreciate the time both of you have taken out for us to really educate ourselves on this. I mean, the amount of WhatsApp forwards that I've gotten is just astronomical. I'm sure that's responsible for 50% of my battery usage on my phone here. So.
Yeah, no, I'd like to thank you, Seth, for organizing this. I know hosting it is not an easy chore, but this is an important community service. Yes. And I thank you and the Sabah BOT as well as the OMC for hosting this webinar.
Thank you.
Thank you as well. I shared some links with Brother Asad for the coronavirus self-checker. That is an app that CDC has developed, and some videos from CDC, and just feel free to use them. And I think people might have a lot of spare time to watch YouTube videos.
Yes, definitely. Inshallah, that's the least of that's the most of our problems. But just to bring everyone a little bit up to speed on sort of what Sabah itself is doing, we have a program out there that for anyone who needs, who must stay home, especially the older generation and others who may be immunocompromised, who need to get groceries or other items from outside the house, but need help from the community or from just in general. We have a team that has been set up. And in the description of the video, I'll put a phone number to reach out to. You may have seen some of the flyers that have gone out about that. We have a team, people sort of in cities around the Bay Area to help go buy groceries, go buy some of the things that you may need, and bring it to your door. Look, at the end of the day, this is a tough time for everyone, and we want to make sure that as a community, we're the strands and connections that we've built over these years are really there for us to sort of pull together as a community and make sure that we can take care of each other. And this is one of the ways that we can do so. So if you do need that, groceries, other things, please do reach out. Also, there's some other sort of projects that are in the works. If you do have any ideas about how you or your family or others can help, please do message either the text phone number that has been put out, or email the Sabah emails that and kind of WhatsApp groups that to let us know how we can help facilitate the project that you want to do to help care for the community and help pull us all together, inshallah, to come out on the other side of this, a better, stronger, more closely knit community, inshallah. So again, just wanted to thank everyone for tuning in and giving us an hour or so of your time. We hope that we have been able to answer some of your questions, bring some knowledge to something that there's just so much unknown about. So thank you very much, everyone. Thank you again to our guests, Dr. Farnaz and Dr. Ajaz. And inshallah, we'll touch base with the community soon, inshallah. Please check the website, check the app, find out about upcoming programs. Inshallah, this Thursday, we will be having a Dua Kamel program virtually, unfortunately, but inshallah, we'll hope to see you there. Thank you very much. Thank you very much, everyone.
Assalamu alaikum. Thank you.
Thank you.
Thank you. Assalamu alaikum.